Good morning, ladies and gentlemen. This is Annalise Garrison. As many of you know, I've been helping to facilitate studies for the NCLEX since 1997, and I've been in the medical field for 31 years. Now, I need to explain this presentation. This presentation is going to be about types of NCLEX questions that the NCLEX may ask you. I do have EKGs for the NCLEX for beginners, so look that up if you want to know specifics, okay, about the heart rate, whether it's irregular or regular, what exactly is a supraventricular tachycardia, what exactly is atrial fibrillation. Again, look that YouTube video up. That's still in existence. But today, I want to focus on the kinds of questions that the NCLEX will give you when taking your state boards. And they usually do it 4 ways. They may give you a medication and ask you what to assess for. They will give you the strip and ask which strip would you see first. They may give you the signs and symptoms and ask about a medication, or they may give you the name of a strip and ask you to pick the correct strip that they named in the question. So they're making it quite interesting. So now here is an example of what to assess for. Notice that the question is this: the healthcare provider is performing an assessment on a patient who is taking propranolol or Inderol for a supraventricular tachycardia. Which assessment finding is an indication that the patient is experiencing an adverse effect to the drug? Now, propranolol is a beta blocker, and it can be used to treat high blood pressure. It can be used for chest pain. It can be used for uneven heartbeat, such as atrial fibrillation. It can also be used to treat tremors and proliferating infantile hemangioma. In addition, it can prevent migraine headaches. So there's a lot this can do. So the answer to this particular question is, for this supraventricular tachycardia, is that we would assess for bradycardia. All right, let's go to the next one. Well, there's one thing I want to say is, I don't want you guys to confuse your supraventricular tachycardia with your ventricular tachycardia. Your ventricular tachycardia looks like a continuous set of mountains, right? Whereas your supraventricular tachycardia is very fast, but notice the RST wave. That's really what the difference is. The RST, and then real quick, like that, you know. So you can really see the difference between supraventricular tachycardia and ventricular tachycardia. So that's just one way the NCLEX can ask you a specific question. Another way the NCLEX can ask you a specific question is they might give you 4 strips and say, who would you see first? Now this you really have to study in the e-booklet that I sent you, okay? So the top one here, A, is atrial flutter. The second one, B, is a first-degree heart block. These are when people have TIAs. They usually get over the first-degree heart block. All right? And then we have the supraventricular tachycardia again. And then we have the myocardial infarction. They're going to have all 4 strips and ask you which would you see first. And you, of course, would want to see the myocardial infarction first. That would be your 3rd-degree AV block, which leads to a heart attack, right? So this is an example of whom would you see first if the NCLEX gives you 4 strips. This next slide is an example of the NCLEX giving you signs and symptoms and asking you what strip is the correct strip as it pertains to the signs and symptoms. So, in this particular example, the client complains about general fatigue, rapid irregular heartbeat, dizziness, shortness of breath, fainting, and confusion. The nurse knows that this client is possibly suffering from AFib. You just have to know that. I do tutor that, and while I tutor, I do a cardiac recap, and I tell you which is the most important strips that the NCLEX likes to pick on the most, and there's 5 strips. So I will go over this in tutoring, maybe just not here at this point in time. And then the last kind of question the NCLEX will give you is it'll give you 3 or 4 strips, right? And it'll ask you to name it. So what is the name of this strip? So you go ahead and try to name the 1st strip, the 2nd strip, the 3rd strip. Like I said, they'll give you blank strips and ask you to name it. So be on the lookout for that. All right? Here is, I know that the NCLEX, a lot of times the answer is lidocaine, right? And what are we using lidocaine for? Well, lidocaine is used for heart arrhythmias. Lidocaine is the most important Class B antiarrhythmic drug. It is used intravenously for the treatment of ventricular arrhythmias. It's also used for acute myocardial infarction. It's used for digoxin poisoning. It's used when we have to do cardioversion. And it's used when we have to do a cardiac catheterization. And we use it in case the amiodarone is not available or is contraindicated. So we use lidocaine if amiodarone is not available or if it is contraindicated for the reasons that I just said through A to D. Now, this I thought was an important thing to tell you for the NCLEX, okay? These are the meds given to treat a heart attack include aspirin, thrombolytics, antiplatelet agents, pain relievers, various blood thinning meds like warfarin, nitroglycerin, beta blockers, and ACE inhibitors. I will go over this when I tutor you, but for the purpose of this slide, I'm just mentioning them, okay? I also thought it was good to know the common emergency meds, your common cardiac emergency meds, and the milligrams of them. This seems like something the NCLEX would ask, right? So you want to give aspirin, 300 milligrams. You want to give atropine injection, 600 micrograms per milliliter. You want to give a digoxin tab, 250 micrograms. You want to give, for us, the water injection, okay? And that's 50 milliliters for every 5 milliliters. That's the concentration of it and how you have to mix it up. for the furosemide. Again, the NCLEX has lidocaine as an answer a lot. So know that lidocaine 2%, 5 milligrams is given. That's in a 100 milligram bolus. Okay, so you mix it with water. And then you have your glycerol trinitrate spray. Obviously, they're having a heart attack. They're not going to be as responsive to you, so that's why it's a spray. Okay, and then you have your tenecteplase vial, and then you have your dalteporine injection. These are the most common cardiac emergency meds when someone goes into cardiac arrest. So don't be surprised if one of these meds are on your NCLEX, or possibly more than one. I'm just giving you 4 ways the NCLEX may ask you questions. And that is, they may give you a medication and ask you what to assess for. They may give you the strip and ask you what strip would you see first. They may give you the signs and symptoms and ask you about a medication. Or they may give you the name of a strip and ask you to pick the correct strip that they named in the question. And that's just that easy. Again, if you want to see EKGs for the NCLEX for beginners, if you want to understand how to read the cardiac strip, go to my other YouTube video. Now, if you're getting a cardiac question, you're getting an expert question, and that's a good thing. So I do tutor this in depth. All right, you just got to go to my website and click on, if you just want me to tutor cardiac, there's a drop-down box that says EKGs. Just pick that, okay? And also feel free to call me or text me or email me. All my information is right here. All right, guys, thank you very much, and I'll see you next video.
You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders.
Sing your praise to the Lord. Come on, everybody, stand up and sing one more. Hallelujah, give your praise to